Range of motion, knee extension. Have your partner lay supine on the mat with her legs extended. The axis of rotation is the lateral epicondyle of the femur. The stationary arm is aligned on the thigh at the greater trochanter, and the mobile arm is aligned with the lateral malleolus. Normal range of motion is 0 degrees. Range of motion that I recorded was also 0 degrees. Range of motion, elbow flexion. Have your partner lay supine on the mat table with her arm at her side and the forearm in a neutral position. A rolled towel or face cradle under the elbow to elevate the arm. The axis of rotation is at the lateral epicondyle of the humerus. The stationary arm is aligned with the lateral midline of the humerus. The mobile arm is aligned along the radius and the radial styloid process. Normal range of motion is 145 degrees. The range of motion recorded was 142 degrees. Range of motion, cervical side bend. Have your partner sit at the edge of the mat table with her head in a neutral position. Place the center of the rotation over the spinous process C7 vertebra. The stationary arm is perpendicular to the floor, and the mobile arm is aligned with the occipital tuberosity of the skull. Normal range of motion is 45 degrees. Range of motion that was recorded was 43 degrees. Manual muscle test, obliques. Have your partner lay supine on the mat table with her legs extended and hands collapsed behind her head. Have your partner curl up as far as she can while rotating to one side, bringing her right elbow to her left knee, testing the right external obliques and the left internal obliques, while bringing the left elbow to the right knee, testing the left external obliques and the right internal obliques. Watch for how high the scapula on the side of the working external obliques can get. A grade 5 is given if the inferior angles of the scapula clear the mat and hands are behind the head. I would give my subject a grade 5. Manual muscle test, psoas. Have your partner sitting on the edge of the mat table with her feet off of the ground. Have the examiner standing on the side of the testing leg to instruct your partner to flex her hip up while sitting tall, assessing her range of motion. Examiner place one hand just proximally to the knee joint on the distal femur. Resist in a downward direction. I would give my subject a grade 5. Manual muscle test, serratus anterior. Have your partner sit on the side of the mat table with her arm flexed forward at 130 degrees. Instruct your partner to reach for the wall in front of her to protract her scapula as much as possible. The examiner is standing on the side of the testing arm with one hand placed right below her scapula to stabilize her trunk and minimize rotation, while placing the other hand on the forearm just below the wrist. Examiner will give resistance in a downward and backwards direction. My examiner, I would give a grade 5.